this evening. Okay, this meeting is the League of Women Voters. I'm Marion Connors. I'm the president, and I will shortly turn this over to Carla Christensen, who's our program chair. But tonight's program is actually a follow-up on a program we had a couple of years ago. But given all that has happened in between, we think it's absolutely critical to get an update in terms of what has happened, what has the impact of COVID been in terms of populations who are challenged economically. Carla will introduce our speakers and we'll turn it over to them. And then afterwards, I'll have a few comments about ongoing events. This meeting is being recorded. We will ask everyone to please turn off your video when the speakers begin so that we can preserve bandwidth. If you have questions during the presentation, please put them in the chat room. And at the end of the program, Carla will go over all of the questions with our speakers. So with that, Carla, please.
Good evening, everyone. We're so happy you're here. Tonight we have the pleasure of having Kim Morgan, who lives in Connecticut, join us. Kim has been working in a nonprofit organizational management position for 30 plus years, always. She has been working to improve the quality of life for those impacted by poverty, mental health, and substance abuse issues, and working with the homelessness population. Currently, Kim serves as the Chief Executive Officer for the United Way of Western Connecticut and its subsidiary organization, Prosperity Digital Marketplace. Over the past several years, Kim has transformed the business model for the United Way to focus on delivering services to households that live paycheck to paycheck. ALICE, which stands for Asset Limited, Income Constrained, Employed. In 2021, the subsidiary she launched, Prosperi-Key, a digital marketplace for households living paycheck to paycheck, is run by Kim. She is actively raising $5 million, building the technology startup team, setting the business strategy, and engaging a full community to make a difference. Kim has served on multiple boards. She holds an undergraduate degree in psychology and an MS in management communications. Sheila Pilot is local. She is the Vice President of Resource Development for the United Way of Volusia-Flagler counties. She has spent the last 25 years in the nonprofit industry also, before coming to the United Way of Volusia-Flagler counties in 2019. Sheila worked for the YMCA movement as a branch executive director after having served in various positions and departments throughout her career. At the Y, Sheila's primary responsibility included overseeing daily operations, volunteer board development, and resource development through annual campaign fundraising and a capital campaign to build a new Y facility that also serves as an emergency shelter for the county. Now, the United Way here for 2 years, she's responsible for overseeing a $2.1 million annual campaign to meet the needs of Flagler and Volusia counties. Sheila holds a master's degree in social work from Virginia Commonwealth University and a bachelor degree in social work from Concord University. Sheila resides in Palm Coast with her husband, Scott, who is retired military and currently works for USDA. She is the president-elect of the Rotary Club of Flagler Beach and serves on various local and district offices. And she enjoys traveling, reading, and her fur babies, Nala and Aphrodite. So as I'm talking about the cutest dogs in the world, I may have missed that hers qualify also in that category. So we are delighted today to welcome both Kim and Sheila and to learn more about ALICE. Kim?
Thank you, everybody. Good evening. And thank you for having me I said earlier, I feel like I'm crashing the party and that Susan let me in the back door. But I'm really passionate about this, this topic. And, you know, as we mentioned, the term is ALICE, Asset Limited Income Constrained and Employed. And I love when I find like-minded people who want to discuss this. So I don't know if we're going to pull up the slides, but if you could start doing that while I'm getting going. I've been working with this population, Alice, for the last, since 2014. And I know that Susan Bailey has been a strong advocate in your community. So when she asked if I would speak, I of course accepted. I'm going to share some high-level national trends and some information with you first, and then share a little bit about this national project that I'm involved in and leading around ALICE. I'll probably only speak less than 10 minutes because I'm sure you're eager to really hear what this means for your community. And we're really fortunate. I'm looking forward to hearing from Sheila about what's happening in the Volusia-Flagler County. And she can really dive deep into where ALICE is, where you live. And I know that you care about your neighbors and you want to make a difference. So I will go as quickly as possible through my portion. Let me just move everybody's pictures to the side. So, you know, ALICE is it's basically started with a report that came out of United Way of Northern New Jersey. And it's in about 22 or 23 states now. It's been expanding. And I believe that Florida and Connecticut started with their first reports in 2014, as I mentioned earlier. And basically what we found is about 42% of Americans across the country can't afford basic necessities. It is a population that is working. They are generally right above the federal poverty level. And that means that they don't actually receive benefits in a consistent way, right? Like they may not get food stamps, or they might get them sometimes, and it might be $12 a month and not doing a whole lot for their household. Housing, childcare, things that keep people who are really low income secure are not available to the ALICE population. They really fall in the middle. And people are always amazed. So out of that 42%, about 10, 11% is typically at that federal poverty level, and the rest are caught in the middle. And they're working in jobs that are really critical to all of us. They're in the healthcare industry, they're in the school system. They are the one that helped you at the grocery store today, or Starbucks, in the hospitals and nursing homes as you know, healthcare aides. They're generally making anywhere from, you know, $10 an hour to $20 an hour. So even someone who's making combined between two in a family, $25, they're still below that household survival budget. In Connecticut, a family of 4 with 2 little ones in childcare, and I'm sure these numbers are going to differ from what you're going to hear from Sheila, but you would need to be making at least $91,000 to be able to get by every month and pay all your bills. Everything's based on that household survival budget. And that budget is based on where you live. It's every county in the country is a different number. It's based on who's in your household. So it's, you know, what the ages are. Do you have a senior? Do you have young children? And then it's based on your income. And that's who we'll be focusing on tonight. You can go to the next slide. When you look at the national map, this is a 3-year average, and all of this data can be found on unitedforalice.org. That is the site that United Way of Northern New Jersey operates. And there's a really interesting tab on there called Research Center. You can find out and dive into information on every county in every state, and really find out what the trends are and what's happening in those states. And so when you look at this, you can see very quickly, Florida is in the darker range. And that is the percent that are falling below that threshold. You know, the next slide. Factors that impact ALICE families. So they're often unrecognized, and yet they keep our economy running. I keep saying to everyone during the pandemic, it was the first time that the grocery store employee was the hero, and that's who we're talking about. And we saw thousands of people line up in their cars for food. And the news reporters would go out and interview them, and they would say, you know, I can't believe I'm here. I never expected this to happen. They're one crisis away from really ending up in trouble financially. And they often pay their bills with credit cards. So a couple things that we know about Alice: they never recovered from the Great Recession. The income gap continues to widen, and we know that with the pandemic, it's widened even more because the households that could work from home because they had jobs that were more professional and not frontline, and people who are in the market, stock market, are doing very, very well. They've done great during the pandemic. And those that ended up losing their jobs and losing the consistency of hours, or faced, regardless of what their situation was, they had to go out and work despite what the health concerns were. That's who we're talking about today, and that's Alice. They are making tough decisions in 6 essential areas, and this is where we have the budget broken down. It's in housing, it's in childcare and education, food, transportation, healthcare, technology, taxes. Those are all affecting the decision-making for Alice. The basic costs are rising each year. A 15-hour hourly wage is what we're looking up in Connecticut and New York and Massachusetts. And the challenge is that, one, it doesn't meet, it doesn't get you above the Alice threshold so that you're secure. It also ends up putting you what's called a benefit cliff. So while we might be able to say in a state that's raised the minimum wage, hey, we got all these people out of poverty, what we really did is we pushed them from, let's say they were making $11 or $12 an hour and they might have been getting food stamps. We've now pushed them out, and what they're making is not the same as the benefit they were receiving, and they are actually worse off sometimes when those wages go up. It's a really tricky thing, and we hear over and over again stories from people who say, I didn't take a raise, I didn't take a promotion, it's just too risky to go that little bit more and lose the safety net for my family. I talked about Alice being in the essential services, bearing the brunt of a lot of the fluctuations that happen, like COVID. And the bottom line is they earn too little to save long-term, and yet too much for assistance. And that savings is a really important piece, as is debt. Alice doesn't have a lot of assets, so when an emergency happens, it goes on a credit card often, or they save and save and save, and then one little thing wipes that savings out. I'm going to talk to you for a second about Prosperi-Key, which I'm really excited about. My United Way started focusing on this population, like I said, in 2014. We went out and talked to hundreds of Alice residents. I basically told my staff, for the next year and a half, your job is to just listen to people and talk to them, and to actually bypass what we would usually do as a United Way, is talk to just agencies and really talk to the people that are being served. And we learned that the social service system isn't really designed well for the Alice population. And we started to create some new programs. So instead of just pushing people to food pantries, we found a program where people could shop in the grocery store. And when they scan an app at the register or a card, money comes off their bill for their produce that we support. And we found that enrichment activities for kids was a real priority for families. Music, sports, arts, they all have to get paid for now. It's pay for play. And we did research and found that the benefits of being part of a sports community team in the arts is actually tied to economic prosperity, because they network with more affluent peers, they get scholarships, they learn the discipline. So we started a fund for enrichment activities, and we were bumping into the fact that we would send people to an agency and then they would cut the check, and there was a barrier there because when the check arrives at the basketball club for your 10-year-old, the coach knows that this family got the charity, and et cetera. And both these programs we were really proud of, but we couldn't figure out how to scale them because we were only working through nonprofit partners, and we needed some kind of income verification, and we couldn't find one. So we decided that we would build it. My board said, when you build it, because it's going to be costly, let's not make it for our 15 towns. Let's make this really a national effort, design a model that will scale and serve the majority of Alice households in the community. So you can go to the next slide. I should mention too that we recruited a number of Alice households where we actually pay them to advise us, pay them $15 an hour to sit with us every single month and advise us on everything we do. So every time we start a program, they test it for us. And the platform that we designed, Prosperi-Key.org, they had a say in the marketing, like the logo and the colors. They had a say in what offers are on there. They've been integral to everything we're doing. So we decided to create this unique digital marketplace where we're connecting people who need help with those who want to help. And so Prosperi-Key is offering direct access to benefits. Think about Groupon. It's like Groupon for this population. We're bringing in small businesses and large national businesses to offer discounts. So it might be your local barbershop. It might be a restaurant. It could be a service of some kind. And they're offering a discount specifically to this population who is often their own employees. And then we're also layering in the nonprofit programs that serve Alice, and we're weeding out the ones that serve only poverty. We're driving people into the site who are Alice through an income verification process. We have not, we've raised the ceiling, not the floor, right? So we say anybody that comes in at the Alice threshold or below, but we want to make sure that every service on there can serve the entire population. And then we brought in government and donors, and we really feel like putting all this together creates a real good marketplace, but we needed a partner. And of course we were, I should mention, we formed a subsidiary to build all of this. And ultimately we wanted United Way Network to be part of it. So we designed a system where the United Ways, the local United Ways, become hubs, and they go out to their local businesses that they have relationships with, and they go out to their local donors, and they go out to their local nonprofits, and they bring them onto the platform. They're able to raise money for their own programs and keep it local by the businesses and sponsors coming on. And then the product is national, but if you're in a hub where we have a United Way partner, it's much more robust. And so we're just starting. We launched the platform in August in Connecticut and Dayton, Ohio. Buffalo, New York comes on in November, and then we're going to grow from there. Our intention is to have at least 100 communities in the next 3 years and reach about 500,000 Alice members and 3,500 businesses. You can go to the next slide. And the way the platform works is that Alice comes in, we mark it out, right? We're targeting both through the United Ways, through social media, through advertising. They come in, they go through a qualification, and then they enter into the marketplace, and they can see all the offers, and they're all delivered to them in a way that matches where they live and who's in their household. And then they can access all of those different services. And if you go to the next slide, I have a screenshot of a piece of what it looks like. You can go to Prosperi-Key.org, it's live, and peruse it and join it. People can join with just their email and zip code to see what's open to the general public. Things like discount prescription drugs, and this other 211 is on there. So feel free to go on there and check it out. And then if you know somebody who's living paycheck to paycheck, then they go through the income qualification and access more. You won't find anything local yet because we haven't launched in Florida. But basically when somebody gets in, they see these categories on the left. So there's both issue areas, and there's probably about 12 or 13 of them. And then there's some special populations like seniors and veterans. And we're talking with some folks at the Department of Corrections about whether we add in people who are re-entering from prison, or whether we add in people who are first-time immigrants, things like that. And then on the right, you'll see these cards where they have the offers. So in the marketplace in particular is where we're putting our businesses. So this is just a sample of some of the ones that are in my footprint that are participating. And they would click on that. And then if you go to the next slide, they'll see an ad or an offer pull up. So this is a made up Mario's Pizza, but you might see a childcare program. Our hope is that we drive people in for a free oil change or half off a pizza and help them for the day with something that they were going to spend money on anyway, or a treat for their family. But long term, we're really driving people to vocational opportunities, education, financial literacy. Everyone on the platform can have a financial coach for free. And that's really where we're trying to drive, is the long-term stability. And then people redeem the offer, or they call the nonprofit, or they fill out the application, whatever it is that group has put onto that page. And so that's what I've been doing. I'm really excited about really reaching and spreading out and creating a way for serving Alice in a different, disrupting that social service framework, and really serving them in a way that meets the needs that they have in a dignified way. They can access things at night, during the day, whenever it is convenient for them. And then also creating a way for United Ways to start generating new revenue and having new relevance to a lot of those small businesses in their community. So I'll pause there and turn it over to Sheila, who's really going to talk about who in your community is Alice.
Right. So thank you for that. I am interested in learning more about how that works and how you integrate 211 along with that. So we'll have that discussion a little bit later, maybe even offline to take a deeper dive. If you can go ahead and pull up the PowerPoint for me, that would be great. There should be a hyperlink on the very first page, because we're going to walk through a simulation together. And this is where and if it works, then this is the part where you will help me make some decisions, and you'll participate. So this is a participation activity, and you'll need to help me make some decisions along the way. So where it says Alice simulation, see if you can click on that, and it should take you to our website. All right, so this says take a walk in my shoes, and if you'll click the take a walk for me. And basically what this is, as Kim was saying, you know, Alice is, people who fall into the Alice population, and this is an introduction to 3 different Alice people that are, you know, they may not be real people, but they're real people. And so I'll have you click continue. And one more time, click continue. And if you want to take a deeper dive on this, this is on our website, and you can do this on your own. And the purpose of it is for you to choose a character, basically, and walk through the scenarios. Whether are you going to take a risk, or are you going to not take a risk? The same types of risks that our Alice families have to take every single day. So I'm going to have someone shout out, who do you want to be, Dave, Amanda, or James?
Amanda.
All right, let's pick Amanda. All right, and so you can see that Amanda is 23 years old without family support. Dropping out of high school was her only option when she became pregnant with her son. He is now 6, and her sole responsibility, leaving limited options to schedule shifts and childcare with your part-time waitressing tips. Her monthly income is $2,000. I'm going to pause for just a second. You'll see on the screen where it says 0 at the right bottom. As soon as she clicks start, that's going to calculate to $2,000. So click start for me. All right, you can see it, the $2,000 on the bottom right. It's the first of the month, and your fixed expenses are due: rent, phone, and car payment. Subtract 15 from your budget, press continue. And you can see on the bottom right again, it went down to 500. So it's going to keep a tally for us so we can see where we are from a financial perspective. You are offered full-time hours at the restaurant where you work. Which shift do you request, lunch or dinner? Somebody give me an option here.
Lunch.
All right, let's click lunch. All right, you work the lunch shift. You will earn less on tips, but your son will be in school during most of your work hours. You make an extra 1,000, but now you need 2 daily hours of childcare for your son, costing 200 per month. Add 800 to your budget. Click continue. And you can see at the bottom, it changed it to 1,300. Your housing voucher to help pay rent is based on income. With the extra income from working full time, your rent increases by 200. Subtract 200 from your budget. Click continue. Your car starts acting up and probably needs fixing. You can have a mechanic fix your car or risk not fixing your car. Are we going to fix or are we going to risk?
Risk.
All right, click risk. Now it's thinking because it changes the scenario from time to time. And your car breaks down on the road. You have to pay to have it fixed plus the extra fee for the tow. Subtract 600 from your budget. Click continue. And you can see at the bottom right, we're down to 500. We're only at February 19. You've been thinking about getting your GED and you call 211 first call for help on where to start. They refer you to the Adult Literacy Center where you sign up for your GED prep classes, subtract $25 from your budget. Okay. With your new full-time hours, your son will still be eligible for Florida Kid Care, but you will no longer be eligible for Medicaid. However, as a full-time employee, you're now eligible for health insurance benefits, but you have to pay part of the premium. You can sign up for health insurance at work and pay the premium, or risk not having health insurance for yourself. Which do you do?
Risk not having health insurance.
All right, risk it. You stay healthy this month, your budget stays the same. Click continue. Unusually cold temperatures in February sometimes kind of happens in Florida. Mean your utility bill is much higher than expected. Subtract 300 from your budget. All right, so Amanda's balance is 175. I've seen the scenario several different times, and I've seen it in the red. I've seen it, actually, this is one of the best that I've seen it. It's almost always in the red. But can you imagine living in this situation every day that, you know, you're having to think, am I going to risk it or am I going to fix the problem? Most of us would not think twice about fixing our car. Your car broke down, you need something fixed. You're going to get it fixed. You have to have transportation for your job, for errands, whatever it is that you want or need to do. And people in the Alice population don't always have the luxury of reliable transportation, reliable housing, reliable childcare. And you know, Kim had mentioned earlier, it's about 6 different categories. You know, you really have to sometimes, okay, I'm going to not put my child in a licensed facility because I really need the health insurance because I have pre-existing conditions. Or I really need to just take the bus because I really want my child to be in a licensed childcare facility. These are the things that they're weighing every single day. And a car breaking down, a child getting hurt, breaking their arm, insurance doesn't cover it, can put them in a negative situation. And when they're in a financially negative situation, then they risk losing their home, losing their vehicle, losing their health, losing their job. So it creates a whole spiral effect. I'm going to have you go to the first page of my slide, please. But like I said, there are several different scenarios, and whether you risk or don't take a risk on these, they change every single time. And so it's kind of a neat thing to be able to go to. And while we might not have been in Amanda's shoes as a pregnant teen having a son and working as a waitress, we probably know people who have been in those similar situations, or at least know of them. And just imagine how they have had to juggle all of these decisions. All right, I'm going to have you go back to my PowerPoint, please. Are you able to get back to the PowerPoint? Because I do want to share a few numbers with you so that you know locally what Volusia is faced with. So Volusia County has a population of about 550,000 people, and 45% of the population falls into Alice. So roughly 250,000 people in Volusia County alone fall into that population. And so let's see here. Let's see if I can. Are you able to get to the PowerPoint?
Nancy, maybe if you stop sharing and reshare, it would work.
Sorry about that. I was showing it online, but I will get back to screen share. Try that again. Thanks for bearing with me. Oops, sorry.
Okay. That's okay.
There we go.
All right, click one more time.
Can you, okay.
There we go. All right.
Okay.
So, yeah, it's on a delay of some kind. So it's not showing everything. Click one more time and see if there are some numbers there we go. All right. So I just shared that 45% of the population in Volusia County are in the Alice population. So the likelihood that you know someone who fits in that population is very high. They are in retail. They're the CNAs, you know, taking care of our parents and grandparents in hospitals and nursing homes. They're in our hotel industry. They're the people that are doing our hair and our nails. They're at Publix stocking the shelves and in Walmart bagging our groceries. That is who Alice is. And so you know the face of Alice. If we can go back.
Sorry, I'll go back to the beginning there.
All right.
Is that where you need to be?
One more back.
Okay.
All right, there we go. And so Volusia County is obviously, you know, broken down into many zip codes, and 48% of Volusia zip codes have 50% or more households that fall into the Alice population. 32114 is at 74% of the population fall into Alice. Let that number sink in for just a minute in one zip code. Followed next by 32759 at 66%, both and 32190. And so if we have 48% of our zip codes have 50% or more, you know, that is definitely cause for concern, and taking a deeper dive in what services are available to those counties and where are the gaps. Next slide, please. One of the things that Kim had also touched on earlier is that survival budget. So a survival budget of if you have 4 people in your home, sorry, I have to tilt this up so I can actually see the numbers a little bit better, my old lady eyes. And so you're looking at about $59,000 a year for a family of 4 to survive in Volusia County. That's like by the skin of their teeth, you know, that I don't know a whole lot of places where you can actually rent for, what does it say here? Right at $1,000 for 4 people. I don't know. That's being pretty conservative on that. But that being said, the point between poverty, which is about 27,000, and then you have your Alice, which is at 59,000. How does a family survive when they're making $12 an hour, $13 an hour? and being able to pay for that. You see that there is no wiggle room in the survival budget. And so that's one of the things that is, of great concern. How do you get people to thrive, not just survive? Next slide. So, obviously, who is assisting Alice? Family and friends. Homelessness has a lot of definitions. A lot of people think of homelessness as, somebody sleeping in the woods or on the street. That's one example of homelessness. There are also people who are living in hotels. They're still considered homeless. People who are couch surfing. This week they're staying with grandma, next week they're staying with a friend, the week after that they're staying with a sister. And that's called couch surfing, and there are families that do that. It's not that they don't have a roof over their head for a week or so, they don't have their own home. And so, friends and family are providing temporary housing, tool and trade sharing, access to good employers. That's how friends and family can help Alice. Nonprofits, temporary housing to permanent housing, tax preparation, financial literacy, subsidized childcare, caregiver respite, job training, educational assistance, affordable housing, obviously through government childcare vouchers, housing subsidies, tax credits, educational vouchers, and attracting higher skilled jobs. Employers, a lot of people don't think about these things. A lot of the people who fall into the Alice population are often not full-time, or they work like 29 hours a week, because if somebody works 30 hours or more, you have to pay for their health insurance if you have a certain number of employees. And so if you take time off and you work part-time, you don't get paid time off at all. So you want to work. And so they don't have paid days off. Also, a big help would be transportation assistance, flex time, telecommuting options. I know that not every industry has something like that. Regular work schedules, full-time opportunities, career paths, mentoring, employer-sponsored training, and apprentice programs. Those are things that can help Alice families. And so how do we get to that point? Next slide. So United Way's commitment is to assist families and individuals to move forward or toward economic self-sufficiency. We want people to have a sustainable income. We want people to have access to safe and affordable housing, and we want people to be able to capably manage income and expenses, because those are all the things that put people in a situation that they could be part of the Alice population. And so if we can help people achieve these things, then that helps them move out of the Alice population. Next slide. All right, so just so you know, as far with United Way, Flagler, and Volusia-Flagler counties, some people are not aware that United Ways kind of operate like a franchise. And so when we say United Way, Volusia-Flagler counties, that is all we serve is Volusia and Flagler counties. And so about 6, maybe 7 or 8 years ago, this particular United Way, they were giving out a lot of grants, and there was good work being done, but they didn't feel like the needle was being moved very much, and not a lot of change was happening in the community. No matter what, we still had the same number of Alice families, the same number of people in poverty, and that people were just not thriving. And so they went to a community impact model, and instead of funding 40 programs, with smaller amounts of money, 2,500 there, 5,000 there, they started funding more programs, less programs with more money. So now we currently fund 23 programs and to the tune of $1.2 million, and the grants are anywhere from $10,000 to $100,000. So imagine infusing into a nonprofit $100,000 versus $10,000. Now, once you infuse that much money into an agency, you do have expectations that it's going to be used the way that they said it was going to be used. And so they do have to actually report to us quarterly what change they have created as a result of the grant that they received from us. In this past grant cycle, 2019 to 2021, this was the impact that our funded partners had. 1,305 people served had moved into permanent housing solutions. That's a pretty significant number to take, from those temporary housing situations and put them into permanent housing situations, because the services that are needed in order to do that, it's not as simple as, hey, here's a house or here's a place to rent. That doesn't necessarily solve the problem. Sometimes it's not just because there's not enough housing. What other things might have caused a person to get in that situation in the first place. And it's estimated that most people who are homeless need anywhere from 4 to 6 services to get them to a permanent housing situation. The other statistics there, 56% of individuals in our financial stability programs have increased their income. United Way, financial literacy is a big program for United Ways, and we work with a lot of banks in the area for financial literacy. Our Bank On program also, touches students and helping people to better manage their money and learn different ways to manage their money. Another thing with the VITA program, which is the Volunteer Income Tax Assistance Program, this is a free tax preparation program that is offered to anybody that wants to participate. And it saves you the filing fee because it is completely free. This past year, we had over $2 million in tax returns for the people that we helped. Our volunteers are IRS certified, and to be able to take that money and put it right back into the economy. One of the things that our advisors do with the people that they prepare taxes for, when they are eligible for a refund, they actually advise them to put some money aside into a savings account. And we work with banks to facilitate that process. It's certainly optional, and some people take advantage of it and some people don't. But that's one of the challenges with people who fall into the ALICE population, is that not only do they have very little in their checking account, they're often overdrawn. They almost always do not have a savings account. They have nothing to fall back on. And that is part of the risk that they are facing. I don't remember, is there another slide after this? I don't think so. I think that was the last one. So, I appreciate the opportunity to share a little bit more about what is happening in Volusia County, so that you know that you do know ALICE and what United Way is doing to address that particular population is to help them find ways to have sustainable income, make sure that they are provided opportunities for career placement and getting them the certifications that they might need so that they can be better employed, as well as helping them get into a permanent housing situation. So those are the things that we're focusing on. The other pillars that we always focus on too are education and health, because you really have to have all 3 of those focus areas in order for an individual to thrive as well as a community to thrive. And that's really what United Way focuses on. I'm going to turn it back over to Carla. I do see some questions popping up, but you can facilitate that part.
Thank you so much, Kim and Sheila. The exercise of walking through and trying to envision having such limited funds to make such major decisions, and the decision, I believe, was made to go without health insurance and without fixing the car. Talk about walking on the edge of the knife. As Sheila pointed out, most of us fix our car without question. We may complain, but we get it done. And if the funds aren't there, if the choices are such that you have to make the decision to be without, then the consequences can be totally devastating. This was so impactful. One of the questions that came up, Marianne wanted to know, has the federal funding for children moved the needle? Where we are offered the people are getting $300 per child per month. Is that helping?
I got you.
I was gonna say, if you go ahead from, from your perspective, you might have a different perspective.
So it absolutely is helping on paper to lift children out of poverty. So the extra food dollars or the childcare that's going to be coming, there's a lot of money that's going to be flowing out right now from the federal government. And it's absolutely going to help these families. The challenge is, does it, how long does it last? And does it affect the ALICE population, or is it really driven towards the poverty population? I don't know enough details about everything that's coming out. We're just starting to see a lot of the RFPs and the grants come out from the money flows from federal to state, and then it goes out to organizations. It absolutely will make a difference. I'm just not sure how high up the ladder on the ALICE group it's going to go.
Yeah, I would agree with Kim, because I don't know that there's enough detail yet as to how that's supposed to be implemented. A really good example was the rental and housing assistance that the county received. And this is not a problem unique to Volusia. Many counties across the country experience this, that they receive CARES dollars for housing and rental assistance, and they still have those dollars available. It has not gone out to help people the way that they thought that it was going to. This was a huge infusion of money and throughout the country, and many of it has not been dispersed to people that needed it. And there's a wide variety of reasons as to why. Originally, the way things were written, from what I understand, it had to go to the landlord. It could not go to the individual. And so it really rested upon the landlord as to whether or not they wanted to accept the money.
Yeah. Yeah, there's a lot of money that's sitting or starting to sit that they don't have the mechanism to get it out the way they imagined it would be. And so it's the same thing with unemployment, what happened with unemployment, right? There was a lot of fraud with unemployment, like other countries coming in. I heard a crazy statistic. I don't even remember the exact number, but I think it was in the billions of money siphoned from other countries. And yet you had people who were desperate and couldn't work and couldn't get unemployment, and the lines were long. So it's all in the details, right, of the mechanism of how it gets out and who it gets to, and the details about how those dollars are distributed. And we don't have enough information yet on a lot of it.
Yeah,
it's still.
It was specifically with housing and rental assistance. I mean, the county was, it was not for lack of trying on the county's part to get the money to where it needed to be with people who truly had needs. But the way that it was originally written of how the money could be dispensed, their hands were really tied. That I can't remember. I apologize, because and I'll reach back out to you guys as soon as I know the answer. They may have reworded some of that to make it a little bit easier to go to individuals versus the landlords. But that was where I heard it last, is that was the deciding factor. If it's going to the landlords, many landlords were actually refusing. They did not want the money. They would not apply for it. And so, unfortunately, people in need were the ones who were shafted.
So Sheila, was the reason they didn't want the money because they wanted to force the people out?
That could be one reason. There are a lot of different reasons that have been floated around. I mean, I also imagine that some landlords were probably being paid in cash, and now all of a sudden, if they're receiving government money, there's an income trail,
and there's paperwork
and there's paperwork that goes with it. So I think it was a lot of different things, and I don't want to lump all landlords in with that, because there are some really good people that are taking care of others. But Volusia did see that happen, that they had dollars and they just could not get landlords to accept it.
Oh,
we're talking like over $2 million worth.
That's heartbreaking, to say the least. Marianne was asking, as we walked through that process of making decisions, how do you at the United Way advise clients on balancing or weighing risk? I know you've mentioned that you've done a lot of work with financial education and helping people to understand finances. But beyond that, do they come to you and say, I've got this decision, do I fix it? Do I buy the health insurance, or are they left on their own to?
No, because United Way is in general, United Way is not a service provider. We partner with, we have our funded partners that actually provide the services. So our job is to refer them to people that can do most of this, with one exception, which is our Campaign for Working Families program that is United Way. And that's where we do the bank on with the students. We do the VITA program. We do some financial literacy programs in certain communities. And so we seek them out. They're not usually seeking us out. And so if they do happen to seek us out, then we would find the appropriate referral through 211 to say, you know, this is really the best person that can help, unless it's just a simple question. I mean, any of our staff would help them with something like that. But if they need to take a deeper dive, because there might be other reasons why they're in that situation in the first place, and our funded partners are the experts at providing these services, and we want them to have the very best help. So we're going to refer them to the people that are in the best place to help them. So,
what is the availability in the housing stock in that 600, on your chart, you show really low rent. And what is the availability of that $600 to $1,000 range in rental, in housing?
very little, very, very little, especially right now with the housing market going crazy. People who have homes that they were renting, they're now opting to sell because they can make really good money. So the housing market has actually decreased even further, the amount of housing that is available for people in the first place. Because if somebody's been renting and they've been getting $600, $1,000 a month, whatever it happens to be, they can turn around, sell that house for so much more. And, you know, they don't have to worry about managing a rental property. So it has actually made the housing situation even worse in this area, because the housing market is exploded right now.
It certainly has. It's astonishing. And it
Yes.
isn't just here. It seems to be across the country that the cost of housing has well overshot the ability of people's, while corporations are buying up houses left and right. I don't know how these people who maintain the heart of a community can even begin to afford thinking of home ownership any longer. Susan Bailey asked, it seems that Alice, and I was thinking the same thing, it seems that Alice households would need a smartphone to access marketplace offers. Is anything being done to handle this monthly bill?
Yeah, so on Prosperi-Key, so first of all, everybody has a phone in the Alice population, because it's often their access to the internet. So it's rare that you find somebody that doesn't have some kind of access, unless they're really leaning more towards the poverty level. And we have on the marketplace some partners with low cost broadband, am I saying that right? And we're looking for offers. When we when we did focus groups, we found that access to internet and phone bills was at the top of the list of things that they needed help with, along with auto repairs and food. And we're finding that when we look at the data of what offers everyone is looking at, those are bearing out in the actual activities online. So we will be getting more partners around that because it's a really critical area. But often, now that COVID happened and everyone's kids were online, it's much more, people are more used to accessing everything online than they may have been in the past, but they're all 85% of the people coming to our platform are coming on a phone. So it is the phone that is being used in the household.
Libby was asking, living in Volusia County, how can one become self-sufficient since our county depends on seasonal events and family vacations from our out-of-state visitors to support our local economy? I think what she's saying is it's up and down, it's not steady, it's...
And COVID did not help that at all.
Oh, I
You
would
know,
think
during
not.
COVID, it was the number one need during COVID was food assistance. And there were people standing in line for food that used to donate to food banks previously. And it's a very humbling experience when you have to go to a food bank with your hand out to receive something rather than to give something. And we heard stories of that over and over and over, that was such a huge need. You know, on the good side is that there were a lot of people who were ready to stand, they stood ready to help in that particular area. And we had people, you know, tell us over and over, because I was able to get food at this food bank, I could pay another bill instead. And before, I would have had to make a decision. Am I going to get food or less food? Or am I going to pay this bill in full or at all, or, you know, or none? And so having the food put less stress on some families, because even though it was humbling and embarrassing to have that need, they were still able to at least feed their family and pay all of their other bills. And that was the number one. Obviously, next was rental and housing assistance. Early on in the pandemic, it was childcare, because our essential workers, they needed childcare. And so all of these holes and gaps in services were kind of illuminated during COVID. And it's mostly with frontline workers, people who are working part-time, people who rely on wages versus a salary. And so, I wish I had an easy answer to that question, but it is very, very challenging. It's a multifaceted issue and solutions to help people be self-sufficient. And so I think, that's the work of United Way. That's the work of a lot of the nonprofits in our area, is to get people towards self-sufficiency. And in order to be self-sufficient, you need an education and or career skills, so that you are career ready, and you need to know how to manage money. Those are the things that set you up to be self-sufficient. And so where do we start with that?
Well, it sounds like there are some changes in the approaches, both the Prosperi-Key and the efforts at the local level to do bigger things rather than lots of little things, and that rethinking the process certainly is necessary, because what's really obvious to me is that almost 30 years ago, my husband and I lived in Norway. McDonald's was just new. Everybody was going to McDonald's, and everyone at McDonald's earned $15 an hour. The sign outside my local McDonald's last week said, "We are hiring at $10 an hour." I have no idea why we have the system that we have, but our system guarantees there will always be an Alice population.
Yep.
And there seems to be a whole lot of people who are just fine with that. If you would, I've got one more question. We're a little bit over time here. What was the age breakdown of the Alice population? Are they primarily younger people, older people, or?
Yeah, and Kim just put in to take a deep dive with
Great.
Alice. Go to unitedforalice.org, and you can search by state, by county, all of that, and you can look at all of the different demographics. And it's very interesting if you have some extra time to want to learn a whole lot more about Alice. This is a great website, and so definitely take a look at that. And in Florida, it's still children. I know a lot of people think of Florida as having an older adult population, but it's children that are living in poverty. Not that adults are not living in poverty. I'm trying to remember what Council on Aging, what their increase in Meals on Wheels went to. It was an astounding number of Meals on Wheels increase due to COVID. I am like thousands. I will have to get you the number because I was blown away at how many more people were requesting meals during that time frame. And so it's not that it's across the board, but it is mostly children.
Well, I cannot thank you enough. I think we've all had our eyes opened. Maybe not the way we wanted them to be, but we do appreciate your sharing this information. Kim put in several websites so that we can continue to learn and explore this information. And hopefully our hearts will be moved to reach out to the United Way in a bigger way. We thank you so much for joining us today. I'm going to take just a minute to say our October 23rd Saturday meeting is on affordable housing. We kind of figured these two would go together nicely. So we hope you will join us at 10:30 Saturday, October 23rd for that presentation. And I'm going to have Marianne wrap up our meeting and she'll tell us about the very special event that we have November 4th. And later in the month of November, we will have the cost of clean water brought to us by our natural resources team. And looking forward, we will have a party in December, which we always do. So this is an opportunity for all of us to take time and do some different things. Particularly, we hope you will attend the very special play. And I'll let Marianne wrap up our meeting from here. And again, thank you so much, Kim and Sheila. It was amazing.
Thank you to our speakers. We appreciate your time. As Carla mentioned, we do have some special events coming up. The event in November, Ladies Taking Liberty, is going to be at the Athens Theater. We are going to be having a march as part of supporting that event. It is a fundraiser for the League, part of our Politicos on Parade biannual fundraising. And it's election night. So it's a great time to come together to brush off your suffragette hats and come join us. We think it's going to be an excellent event. It is not the only showing, only performance of that review, but it is going to be the one time that we do assemble and march as a group. Also, as Carla mentioned, we have an upcoming water event that will be interesting, and we are working actively on our holiday activity. We're trying to, I think we discussed, find a day when we can all get together and go see the Mary McLeod Bethune statue, and then perhaps have a group lunch. It will be on a Saturday. We are trying to look for some dates, late October, early November. So just have that in mind for your calendars. And then something that is going on right now, we are involved in redistricting. The county council had an item on their agenda on Tuesday and identified 3 maps as being their preferences. Those maps will then also be viewed by the school board to see if the school board wants to join in terms of the lines. I would, if anyone is interested in this topic for the local issues, please look at the county council meeting for this past Tuesday, and you can see that whole presentation. The agenda item is online, and you can look at the maps. The maps that were prioritized were F, B, and A, if that helps. In terms of the state efforts, we are trying to set up some time with our local representative, Tom Leek. Tom is actually chairing the effort for the House. But if you really can't get enough data and input, the Florida redistricting website is as deep in the weeds as you could ever want to go. And we're going to be trying to find a way of dividing the labor, because it's a fascinating website. It's intended to be interactive. I haven't been that brave yet myself, but it's certainly an effort to have participation. What we haven't really found yet is, are there going to be public meetings? How is this going to in fact be presented to the public? So redistricting is ongoing. I think the local effort will be pretty swift. They intend to have maps identified pretty quickly and adopted by the end of the year. The state effort may spill over a bit, but that's an ongoing effort. So unless anyone has anything else to bring to us, I thank Carla for finding those speakers. It is wonderful that we have Zoom and can still have access to some people on a national level, although we certainly missed the time together, and hopefully viewing the statue will allow us to have that even before the holidays. Unless anyone has anything else for the good of the order. Okay, with that, I thank you all for joining us this evening, and we will look forward to seeing you later this month for affordable housing. Thank you so much.